In the client's home. Plan of care. 1. On your first visit with a new client, ensure that there is an updated plan of care in the home and that it is easily accessible. 2. If it is not in the client's home, contact the office immediately to get a copy. 3. The plan of care will show you which functions you should perform with the client. 4. Use the plan of care to complete a timesheet only when necessary. Prohibited functions: sterile dressings, enemas, colostomy irrigation, vaginal irrigation, application of heat, insertion, removal of inner cannula of a tracheostomy, injections, tube feedings, judgments, advice medical, nursing problems, personal care not included by nurse in care plan, administration of medication to include eye drops and any creams with prescription on it. Performance of eye care including administration of drops or ointments, transport a patient in aid's private car or in patient's car. The home health aide may not leave a case early without notifying our agency first, regardless of patient, family instruction to do so. To do this can result in punitive action. If done consistently, termination may occur. When with the patient, always wear a mask and your ID badge. Prohibited in the patient's home: personal cell phone use, smoking, destruction of property, accepting cash from patient, drug and alcohol use, and theft. Transporting clients. Home health aides are prohibited from transporting the beneficiary in their personal vehicles. If a home health aide does not adhere to this policy, they take sole responsibility for any damage, bodily harm or death that may occur due to an aide who does not adhere to this policy and transports beneficiaries in their own vehicle. If your patient falls, do not attempt to lift them. Call 911. Report the incident to your coordinator even if the patient does not appear to be injured. Call 911 for the following events: severe bleeding, chest pain, loss of consciousness, shortness of breath, blood sugar problems, infection, circulatory problems, heart or lung problems, bleeding, abdominal problems, falls or injuries. A home health aide is an individual trained to provide personal care, light housekeeping and other related tasks to a person with healthcare needs in his or her home. The home health aide is supervised by a registered nurse or licensed therapist who assists him/her with all client care aspects and reports to the case coordinator for all administrative aspects. Hourly home health aides work an agreed upon number of hours daily and are paid for the scheduled hours in the home. Live-in home health aides sleep at their clients' homes, work for 13 hours daily and are allotted time for meals, sleep and breaks. A live-in home health aide must be present in the client's home for 24 hours each working day. Each live-in day is based on a 13-hour plan, and you are to perform tasks during those 13 hours as delineated on your client's plan of care. HHA must take 11 hours of personal time but remain in your client's home during the full 24 hours. This personal time might include 8 hours of sleep time, 3 hours of meal time, reading, watching television or any other form of relaxation. If your client requires constant care and you are not able to take this personal time, notify your coordinator immediately. Please take a few minutes to familiarize yourself with the patient rights included in the Home Health Aide Handbook. Do not go to work and make sure to call your coordinator if you, your patient or anyone in the patient's household are experiencing any COVID symptoms. Emergency protocol: never leave your client alone. Remain with the client unless that client lives with a responsible caregiver who can keep him safe and comfortable. Remain with the client until a relief worker or family member arrives or until the RN in charge says that it's safe to leave. Call the agency as soon as possible to notify us as to where you are, that your client is safe, and for further instructions. Clients with live-in care can never be left alone. You must stay with the client until you are relieved.